Now we're going to mark up the face because there are some important areas to understand what we want to avoid using the microfocused ultrasound, the HIFU. One of the main areas is going to be the trachea, which is where we breathe through, and you can find that on people by just gently or slightly pressing into their neck. It's going to be in the front, and you can feel the edges of it, and that's what I'm feeling for right now. And it comes from underneath your chin, obviously your throat, all the way down. And you're just trying to find the end points of that trachea, and I mark it. So end of her trachea on the side of the trachea is here and here, and then we can draw a line designating where the trachea is and throat. This is an area that we're going to avoid working on. Now, what's important about the trachea is it's also where the larynx or the voice box is, and on men it's a little more prevalent because of the Adam's apple. You can find that very easily. On women, you have to kind of push in a little bit, go right underneath about where their chin is, and start working your way down, and you'll feel the edge of it. If they swallow, go ahead and swallow. You can feel their larynx move up and down. We have the thyroid cartilage that lines that larynx, and just below that larynx or the voice box is where their thyroid gland is. So we want to avoid that. And basically with Ariana, her larynx is right at the crease, basically where her neck and chin merge. So I'm just going to draw a line across here, and what I'm doing is drawing a box around the trachea and the larynx, just to designate it as an area where I don't want to work. So you can put a little X there if you want to, just to remind yourself not to work in that area. Everything outside of that area is fine in the neck area. Then we come up to the face. Underneath the chin, this is the area that we're going to be really concerned with, that she's most concerned with, and this is the area that we're going to want to focus on. When we come up to the face, there's a couple markings that we want to be aware of. The most prevalent or most important is called the mental nerve. There's a nerve that comes out of the brain, and it goes into the mandible, the jawbone, inside it, and then it comes out in the front, right at the front of their chin, and there's two little holes called foramens. And what I usually do is, if you looked at their crease of their mouth, it goes straight down, and you press in slightly. You can move your finger back and forth and find, is that the area right there? A little more sensitive. Yeah. You can find a little indent. That indent is where I would put a mark. That indent is where the nerve is coming out, and you'll know that it's a little sensitive right there. You can find it and press on it, and they'll tell you that's right where it is. And that's the nerve we want to avoid passing over with the HIFU machine. That nerve runs up the side of their face, up directly perpendicular to the crease of their mouth. So I usually draw a line there, and that designates the nerve. I want to stay away from that nerve if I'm using a deeper cartridge. You can get away with it with a 1.5, maybe a 2.0. Some will say you can use a 3.0 on it. I don't take the risk. I stay away from it with anything but a 4.5 and a 3.0. I'll stay away from that nerve. But you can come right up to the edge of it. That nerve distributes its nerve fibers up into the muscles of the cheek, so it comes up and disperses out. Those are the basic markings I want to really emphasize when we're marking up the face. If you're working up above the cheekbones, there's a couple nerves to pay attention to. Right above the eyebrow, almost about right where the eyebrows kind of separate, there's a hole, foramen, in the forehead, right above the orbit of their eye. Is called the supraorbital tori and supraorbital foramens. And those are where nerves come out, and you can put little marks on them here and here. And it's just an idea to stay away from these areas. They're superficial nerves that come out in there. There's a couple of the underneath the eye, right by the nose. We don't usually work in this area. Just be aware of that. Anytime we're working above the zygomatic bone or the cheekbone, I'm always going to probably stick with a 1.5 or 2.0 cartridge anyway. I'm not going to use a 3.0 or 4.5. The skin is much thinner up in this area, and it will be uncomfortable. Anything below the cheek line is we can utilize a 4.5, 3.0, 2.0, and 1.5 cartridge. In Ariana's case, we're going to use a 4.5 cartridge to this fatty area under her neck, which is what she's most concerned with. We can even do a little bit of work here in the neck area the lower portion of the neck with a 4.5 to help loosen up some of this fat. But I do not want to go anywhere in that larynx box or the trachea box. That's how I would mark up the face before we start any treatments.